My husband and I sought treatment with Dr. Kaufman after we had been trying to conceive a child for about a year.
A big question we always get is, when should I seek fertility care? And there are a number of variables. The primary one is age. So if somebody is older, and I try to be really careful when I talk about older, what that means, but probably 35 and older, we need to move things a little quicker. So usually if it's somebody that's 35 and older, probably want to seek fertility care after about 6 months. For those less than 35, about a year.
Working with Dr. Kaufman was different than what we had experienced previously in the year that we were trying to conceive. When we would talk to other doctors, they kind of wanted to just railroad us into being a particular type of case that everyone else was. And then when we met with Dr. Kaufman, he actually gave us hope. He didn't say, well, we'll just do A, B, and C and you'll be on your way. He was personable and compassionate and really made us feel like he was treating us as a couple, not just as a medical experiment on paper.
So we kind of lead a kind of common sense protocol here, where we kind of step up treatments based on the particular patient's needs. And so you try one treatment, if that doesn't work, we move on to the second treatment. If that doesn't work, we move on to another treatment. And so the next tier would be in vitro fertilization, where we actually get eggs from the ovaries, put them in a dish, take the sperm, put them together in the dish, fertilize them, and then put them back into the uterus.
Initially, the idea of doing IVF to anybody sounds extreme and invasive and really scary. However, Dr. Kaufman really demystified that for us and was able to hold our hand every step of the way. We currently have twin daughters who are a little over a year old. When you're going through infertility and you're trying so hard to have a baby, it's not something you just think about once a month or just at a doctor's appointment. It's a constant thing, and Dr. Kaufman really understood that. And when you discuss things with Dr. Kaufman about fertility, again, it isn't just a medical thing with him. He understands that he wants to be a part of helping to grow a family. He clearly cares about his patients as people.